Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Sometimes, in order to solve a big problem, you have to start small, which is why the 6 residents starting St. Alphonsus' new family medicine residency program are so important. For years, Idaho has been dealing with a doctor shortage, particularly when it comes to primary care physicians. Well, now, St. Al's and Mountain States Institute for Graduate Medical Education and Research are taking steps towards filling a crucial gap in our community's healthcare system. Joining us now to talk more about this program is Dr. Lisa Nelson, the Medical Director of Graduate Medical Education for St. Alphonsus Health System. Dr. Nelson, nice to have you on the program.
Thank you, Gemma. I'm excited to be here.
So can you start off by telling us a little bit more about this program and why you brought it to St. Alphonsus?
Sure. Idaho has been dealing with a physician shortage for many years. And we're actually 50th out of 50, last place in the nation for the number of physicians per capita. And it's sometimes hard to recruit to Idaho. And what we've learned over the years with our current residency programs is it works really well to grow your own. We're very good at keeping the residents that we train to practice in the state. And so St. Alphonsus has been working for quite a few years now to be a part of that. And we're very excited to start this family medicine residency in Nampa.
So what kind of need is there for family medicine doctors?
We simply can't get enough. One of the great things about family medicine physicians is they can take care of really the whole person, the whole family from birth through to the end of life. They can do lots of procedures. They can deliver babies. They can do colonoscopies when they're trained in full scope family medicine, and particularly in rural areas, a rural state like Idaho can provide a lot of the medical care that a community needs.
So what kind of factors are contributing to our state's doctor shortage?
I think part of it is just simply being a rural state. We don't have large university health systems. Many of those we only have 16 residency programs in the entire state of Idaho. Some large university centers like Utah or OHSU or up in Seattle might have 20 residency programs or more just in that institution. And because residents tend to stay where they train, those areas tend to have more doctors, whereas we don't have that as much. And that's one of the ways that we'll be able to keep doctors. I think perhaps people don't know I think we're starting to see that with the population coming to Idaho, but what a great place Idaho is to live and to practice medicine.
So you mentioned we only have 16 residency programs in Idaho. So how many kinds of programs do we have like this family medicine residency program here in our state?
So we have mostly primary care residencies. We are the 9th family medicine residency to launch in the state of Idaho. The oldest is now known as Full Circle Health, used to be known as the Family Medicine Residency of Idaho. They are celebrating their 50th anniversary this year, which is very exciting. We have internal medicine residencies throughout the state. We have psychiatry, several different programs in the state. And then many people don't know, we actually also have a dentistry residency through Idaho State University.
So talk to us a little bit about what your residents going through this particular program will be learning.
They will be learning, as I mentioned previously, full scope family medicine. So they will be learning pediatrics. They will be learning how to deliver babies and pre and postpartum care. They will be rotating in general surgery. They will be in the emergency department. They will be inpatient. They will, let's see, what else will they do? There's so much they have to learn as a family medicine physician. I have a lot of respect for our family medicine physicians because of the breadth of what they know. They'll be learning procedures. We are partnering with several different other health systems. They'll be doing some of the rotations at Terry Riley out in Nampa for behavioral health. So it's a really broad spectrum of medicine that they'll be learning
Mhm.
over their 3 years of residency.
So you've mentioned that for a lot of residents, they end up practicing where they did their residency. So with that said, do you believe that programs like this one will actually help to not just bring doctors here, but to keep more doctors here after their residency?
I do, and we actually have data to prove that. The State Board of Education Graduate Medical Education Committee, of which I am a member, actually tracks this. It's one of our metrics.
So I'm curious about population demand because, as we all know, Idaho is booming, it continues to grow. So, what do patient needs look like right now, in particular, with this growing demand for doctors and then, not enough doctors?
I think one of the biggest challenges is being able to either establish care in a clinic with a new physician. Say you've moved to the area. I definitely have heard friends that have moved to the area to say, I tried to establish care with a doctor and it was months before I could make a new appointment. Some of the other problems people have if they can't get into their clinics is they get sicker. And instead of going to the clinic and having a small matter taken care of, they may end up in an urgent care or an emergency room. So it's really important to try to expand the access. And residency programs are one of the ways that we can do that.
And what kind of impact does this growing demand have on physicians?
I think residency programs, well, they sometimes are kind of fun. It's really exciting to have a new learner who's just graduated from medical school, who is enthusiastic about everything that they run into. It brings the joy of medicine back for those of us that teach. That's really fun. And then just to know that the folks that you are training today can be your future partners tomorrow. I'm an internal medicine physician. I work with the Boise VA internal medicine program, and many residents who I've taught there are now my partners. So it really works and
Mm.
it's a lot of fun.
So, you mentioned that the primary family medicine doctors, primary care doctors, can really take treat any patient in almost any circumstance. So, can you talk a little bit more, really about what kind of difference that type of doctor makes in a community? I mean, in particular, in some of our smaller areas, right? I mean, it's different when we're talking about the Treasure Valley versus a lot of other areas of our state.
That's very true. And I think what's so great about family medicine is you learn a lot about a little bit of everything. So either you're going to learn how to handle whatever clinical situation patient need walks into your office, or you're going to know when it's appropriate to refer it out. And I think in particularly for our smaller communities, that's really important to have somebody with such a broad spectrum of training. And that is exactly what we aim to do with this new program.
So, along with the new program, my understanding is you're also going to be there'll also be a resident clinic. Can you tell us a little bit more about that?
That's correct. One of the things that you need to do when you are a physician in training or a resident is you need to take care of your own set of patients, get to know them over the 3 years of your residency, understand what it's like to manage things like high blood pressure or diabetes over time. And so we will be opening our resident clinic coming up here next week, where people who are interested in being seen in a resident clinic, and there are some advantages to that, are able to actually receive care from our resident team.
And where will the resident clinic be located for folks who want that option?
It is 215 Hawaii Avenue. It's just next to the St. Alphonsus 12th Avenue Clinic in Nampa.
So, before I let you go, Dr. Nelson, ultimately, what kind of impact are you hoping that this program in particular will have?
Well, quite frankly, we're hoping that many of our new resident physicians are going to stay and work for us here at St. Alphonsus in the future. If they don't, we certainly are hoping that they will stay in the state and care for the people of Idaho.
Well, I really appreciate you taking time to talk with us about this. Exciting to have this residency program here. We've been speaking with Dr. Lisa Nelson. She is the medical director of graduate medical education for St. Alphonsus Health System. And we've been discussing a new program that is working to address the doctor shortage in our state with a new residency program. I'm Gemma Gaudette, and this is Idaho Matters.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.